Perfect. So I'll just share my screen. Okay, everyone. So you should see this. This is you're here to discuss the supervision of advanced practitioners. Kira, can you just make sure you can tell me you can see the whole screen? Yep. Brilliant. Fab. Thank you. So everyone, my name's Kerry Magnus. I am the Education and Development Lead for BNSSG Training Hub. This is a primary care training hub, so we're here to help and support you within your role within your general practice setting. And the reason why I wanted to do this introduction to the Supervision Advanced Practice session is because as an advanced practitioner myself, I get lots of questions and queries and sort of trying to navigate and understand exactly what it means. But also, as we know, there's been lots of national, regional and local changes, particularly around advanced practice. And I just wanted to try and explain some of the reasoning behind it, give some understanding really of around sort of advanced practice and supervision in itself, and then obviously sort of provide some resources for you for the future. So hopefully it will cover everything that you've come here for today, but if it doesn't, please do ask me a question. That's absolutely fine. So to understand where we are at the minute, obviously everyone says to me, why do you want to be an advanced practitioner? Now, there are lots of reasons why people want to be advanced practitioners, and we have to understand that these are some of sort of the micro level of the reasons why, and it's to do with sort of that mastery of why you want to be one. You're trying to advance your profession. You've got a bit of financial benefit as well, but also you want to have that social purpose to enable you to provide more for your patients and have a bit of an autonomy within your actual practice that you're doing at the moment. Myself, so I am an advanced practitioner. I'm also a nurse by background, and I still work as an advanced nurse practitioner in a general practice setting. Over the years, so I qualified in 2000, like a lot of us, I've just done lots of different sort of areas of practice. But the things I've picked up along the way, I've been a bit of a magpie with all my different modules. And it's to do, I've done the teaching and learning for health professionals at University of West of England, at University of Bristol. I've done my master's in professional development at UE. I'm currently doing some work for the NMC on this task and fitness group with regards to advanced practice. And obviously with my role at the training hub and Avon LMC, part of my role is around advanced practice and being the advanced practice lead as well. Done lots of different supervision courses, too many to remember actually, and I'm doing more because they keep changing all the time. So it's just to raise that sort of awareness really. What I want you to sort of get out of this session is to basically to learn the basics of advanced practice, be aware of where we are now from a national, regional, and sort of local level, understand the differences for trainees and non-trainee advanced practitioners, be familiar with those minimum standards for supervision and examine those supervisor capabilities. And obviously just know where you can go to get those resources. From a background perspective, advanced practice has been around since the 1970s. And traditionally in general practice, you've had advanced nurse practitioners. But with the introduction of the additional role reimbursement scheme, which is an employment scheme, there has been a push to widen those individuals of those professions working at that advanced practice level. And we now have advanced practitioners in general practice who are paramedics, clinical pharmacists, mental health nurses, physiotherapists. We don't necessarily have any podiatrists, OTs or dietitians, but as part of the employment scheme, they are able to become advanced practitioners as well. And as part of the national drive, they are also able to become advanced practitioners. When we talk about advanced practice is a level of practice, and generally individuals need to understand that what they're trying to do is work at a level where they can demonstrate these 4 pillars of advanced practice, which are clinical practice, leadership and management, education and research. And those pillars, including their capabilities, are set out in the multi-professional framework for ACP in England. That document is a framework that was set up in 2017 and is currently undergoing a few changes. There's not going to be anything dramatic, but it's just to raise awareness that it is undergoing a few changes. This means to say that everything to do with advanced practice in England, I have to say from Scotland and all the other counties, they don't follow this framework. But in England, any university that has an advanced practice course will be going towards getting accreditation for their advanced practice course. We'll talk a bit about accreditation shortly. As part of the content that you get from an MSc and what they're saying that needs to to become an advanced practitioner, you need to have the mastery in a few different areas. So you need to have mastery in leadership, physical assessment, pathophysiology and diagnostic reasoning, evidencing that work-based practice, research, and in some cases, independent prescribing. The reason why I say in some cases is that outside of general practice, if you go to secondary care, in some cases, advanced practitioners do not need to be prescribers. But in our case, in general practice, this is what we're focusing on. When we talk about career pathways, so we've said before that those roles can be, anyone can be within those roles can be an advanced practitioner, but you start off being that registered clinician, then you move to sort of an enhanced level, then your advanced level, and then your consultant practice. Each level you're developing your mastery in each of your skills, and each level you are able to demonstrate your knowledge, skills and behaviors when you're in practice. So as well as having that academic element and that knowledge, you're also able to be in practice and demonstrate those skills to enable professional and public safety. Some of the key challenges with advanced practice that we all know since the 1970s have been these 5 areas. Now, these are the 5 areas that the national and regional and local areas are sort of focusing on, and that's to do with the multiple titles that we all get called to be advanced practitioners, the regulation of advanced practice, whether it's for the NMC, HCPC, or the GPHC, that professional and public awareness of what advanced practice is, the standards that are set, particularly around educational frameworks and what we think advanced practice should look like, and that monitoring of performance. And this is where supervision comes in with regards to the supervision, with regards to the performance element. NHS England have got this sort of definition of what they think advanced practice is. Bear in mind, this is the NHS England version, and each regulatory body will have their own version. But effectively, it's about that demonstration of the core capabilities within that multi-professional framework that covers those 4 pillars. And individuals need to have a high degree of autonomy, decision-making, that you've got that academic level of mastery, and that you can evidence that within practice, and particularly sort of on an annualized basis. Nationally, we know there's lots of things going on with regards to advanced practice, but just a snippet, in 2020, the Centre for Advancing Practice was born, and that is an NHS England centre where it can look at higher education institutes, look at their MSCs, map them against the multi-professional framework, and then give them their accreditation. So that's effectively saying your MSc that you have at your HEI fulfills the level that we want it to fulfill. So any individuals that we fund have to attend these courses. We will not fund any other courses who are not accredited. They also look at supervision, and they're also looking at that consultant level practice as well. They bring in things to do with the governance matrices, and they're also looking at sort of supporting staff in lots of emerging areas as well. I said briefly about the NMC, which I'll go to in a moment, but there's obviously other councils that I've got their little hand in advanced practice at the moment. And the CQC has just developed their advice and their questioning with regards to advanced practitioners, particularly in the workplace. One thing that has sort of supported all of this or is new is if an individual is employed under the additional role reimbursement scheme as an advanced clinical practitioner who is a nurse, they have to hold something called a digital badge. Now, this is where we say for the digital badges from the Centre for Advancing Practice. So to get a digital badge, you have to either have attended one of these accredited courses that the Centre for Advancing Practice have put on, or have gone down something called a supported portfolio route where you can go for that accreditation of your existing knowledge and experience. With the NMC, just to update, there's, as I'm part of the Task and Finish group, the regulations where we are at the moment, there is a phase 2. So we're looking at the definition of advanced practice, principles for advanced practice, that are aligned to key design principles of the NMC. We work with the 4 country working groups, and you have some sort of understanding of proficiency. And we're also looking at the associated education training programs, because we know that that's where the funding comes from, and that's essentially for what the Centre for Advancing Practice are working towards. We're also looking at those transitional arrangements, particularly for individuals who haven't necessarily gone through this new trainee route or have an existing MSc or not doing the supported e-portfolio route. So that work is underway, and more information is on that link there. This is just to awareness of how you become one of their accredited advanced practitioners. And as we talked about, it's about you can go through the apprenticeship route, the non-apprenticeship route, which will then be funded, and you will become an ACP. You can also go through this supported e-portfolio route, and as a pharmacy perspective, you can go through their RPS pharmacy accreditation as well. If you want to undertake your training, then there are options with your funding, and this will depend on your existing knowledge and your existing modules that you've undertaken and the most appropriate route for you and your employer. But we're not talking about that today, but I can obviously go through if you want to learn a bit more, then please do come back to me. Just to raise awareness of stuff that's happening with those sort of 5 key areas, we talked about the NMC and regulatory frameworks. We talked about the educational frameworks and accredited courses and the DES contract. There has been a lot of talk on the National Long-Term Workforce Plan, and advanced practitioners are definitely in there. So they're here to stay, and all this work is going places. So nothing's going to change. It's only going to move forwards. And as I say, we talked about we're going to be talking about minimum standards for supervision and supervisor capabilities. From a professional public perspective, there is a lot of stuff with regards to public engagement and social media, but obviously you've got us as a forum and the Training Hub itself as an organisation that will be here to support you. Just some figures in general practice. Since 2020, we have a total number of trainees who are just individual trainees of 45 trainees who have gone through their funding, which has brought in a total since 2020 of over £1 million into BNSSG general practice. And it's actually going to be more, because a lot of those individuals, 39 of them are apprenticeships. And so those individuals have their apprenticeship has been paid by a levy. So that is a lot of money that's coming into BNSSG general practice. And it shows the dedication that BNSSG has with regards to advanced practice and all of those key areas that we're trying to focus on. The number on the left-hand column you'll see here, so 92, that's the number of full-time equivalent advanced practitioners that are registered on the National Workforce Reporting Service. So on my distribution list, I have over 200 individuals who are actually on that distribution list. So you can see there's a lot of us within BNSSG. So the key thing is, are you an advanced practitioner or are you an advanced practice trainee? And you'll see my son here. So I see that he's a very competent and capable advanced practitioner, but this is where he is also a trainee as well. So I think the first thing I would say to you is reflect onto yourself. Are you somebody that is a trainee, which has got some very set guidance and standards, or are you an advanced practice employed in an advanced practice role who maybe is governed a little bit by organizational things, but there's also other things that you need to sort of consider? And we'll just go through that understanding. With all our advanced practitioners, this is the goal. This is like the golden standard that we want for individuals. And we'll take each section separately and talk about them separately. But it should be an integrated approach with multi-professional supervisors. That should be whether you're a trainee or whether you're an advanced practitioner. You should have a nominated educational supervisor and access to that sort of variety of different workplace supervisors. And ideally, you need to have a combination of academic levels learning at level 7, which is that sort of master's level, and evidence of workplace learning. Now, we know everyone is at a different journey, and I'm more than happy to talk about your individual journeys separately outside of this discussion. The expectations obviously are a little bit different if you are a funded trainee and if you're a non-trainee. So as a sort of non-trainee, you have regulated professional standards, particularly around supervision for each of your professions that you need to follow. You've got the CQC standards, you've got your employment model, whether it's under the additional role reimbursement scheme or not. You've got your organisational policies, and you've also got your individual requirements. And so everyone is very different. That's why it's really hard to be very sort of specific about what everyone needs if you're a non-trainee. As a funded trainee, there are certain things that are required for you to receive the funding from NHS England. The individual, the supervisor, and their employer needs to sign up for supervision for 1 hour a week, that you meet those minimum standards for supervision. You have a coordinating educational supervisor. You've got associated workplace supervisors that don't need to be nominated, but awareness that they're there. You're meeting your educational requirements at your higher educational institutions, and that you're also meeting these apprenticeship requirements, particularly if you're, as I say, if you're apprenticeship, you have certain off-the-job requirements that needs to happen in time. For more information with regards to the expectations, please do click on, we're sending out the slide, so click on the link and it will take you to those supervision, but there's also requirements in the commitment statements that individuals sign and the handbook for the Centre for Advancing Practice. Awareness is that if you are a developing advanced practitioner, you have a lot of competing demands for your time. So imagine me, I'm a developing advanced practitioner. Firstly, it's a job. I'm doing my full-time job, and I'm trying to compete with those demands of my sort of day-to-day practice. I'm also thinking about patient safety. So what's going on? You know, yes, I'm a trainee, but there's other things going on that I need to be aware of. So how can I sort of look after that patient safety? Same with professional safety and regulation. What does it say about my professional safety? What does it say about my regulation? All those things I need to be aware of. We look at advanced clinical practice competencies and capabilities. So the first port of call is to go to your multi-professional framework, and then you have capability standards. Now, those capability standards could be very specific. So if you're an advanced nurse practitioner, there is a capability framework that you can look at. And that effectively says in your role, if you examine patients, you come in with a cardiovascular disease related issue, that you're capable at these different sort of skill levels, and here's the evidence to prove that you can do that. Also about academic progress, we don't talk enough around sort of the neurodiversity of the workforce, things that are difficult for them to understand. What is level 7? How do I critically analyze? There is so many things going on in that individual's head. And also that personal well-being. It's really, really tricky to manage your time and your training alongside your sort of home life and your personal well-being as well. And then what happens when you complete your training? So that transitional sort of arrangement when you complete, what happens now? What do I do? What do I need to do? And as I say, there's more information in those handbooks. When we go back to those sort of supervision things, the first one was around practice context. So when we pick that part apart, that's to say, if you were supervising an individual in practice, you'd need to think about their workforce planning. So have you really thought about the individual themselves? Have you thought about where they sit within your workforce? Have you thought about who's next to do their training? And have you thought about things like job plans and job descriptions? So does their job plan, does their job description reflect exactly what they're doing within their practice? You also have to think of the other areas within the workforce. So obviously within the practice context, there are other competing demands. That there may be other individuals who are going through training. There may be particularly around sort of GPs, and that competition for supervisory time is really, really strong at the moment. Regarding that competence and capability, it's really hard to understand what that is if you're not an advanced practitioner. And this is where a lot of people struggle with this element. And that's purely because I know what it's like to train as a nurse. I know what it's like to go through the training, to work as a nurse, to work as an advanced nurse practitioner. I know a little bit about all the other roles, and probably a lot more than what that I think I know, actually. But imagine if you were a GP who had to know about every single role and know about their training and their learning. That's really hard to do. So what you need to do as an individual is to identify your framework. So is there a framework out there? Map yourself against these capabilities, and can you drive that learning yourself? Because the way things are successful is if you can actually map yourself against the frameworks, go to your supervisor and say, look, these are the areas that I've got evidence that I can prove that I've got that academic competence. I've got evidence to prove that I'm capable in practice because I've got these work-based learning. And these are the areas that I need some more help on. These are the areas that I really need support with, because that way you can build up those relationships with your supervisor, and it becomes a lot easier for you to understand. We talked about multi-professional registrations. As a supervisor, the supervisor also needs to be aware of these multi-professional registrations. And as I said before, it's really hard for them to know what they are specifically. So the role of the trainee or the role of the advanced practitioner is to really understand what their supervisory needs are and to express that to the supervisor themselves, really support them and understand the things they need to do. It's also key that you are fully aware of your scope of practice. So we know that that varies for each individual. So when we talk about job plans and job descriptions, does your job plan map your scope of practice? Does your job description map what you're actually doing within practice? So really think of sort of like merging these together. And if you're asked to do something, is that something that you need more support with and more development with and more supervision and assessment to enable you to get to that sort of level that they want you to be at? It's also just to raise awareness is that the reason we get some issues is around that sort of expectations. So as an advanced practitioner, I understand there are different levels and I'm coming at it from a nurse level, but as a GP, the expectations may be different. As a pharmacist, your expectations may be different. So we all hold different and varying sort of levels, hence the fact they brought in this level 7, because it just tries to make it clear that it should be at that higher end and that sort of mastery. So there is variations, and there will be variations in supervisors with regards to what they believe is the right standard. When I talked about multi-professional frameworks, individuals need to have an individual learning plan. So it goes back to the multi-professional framework. As a trainee, you need to look at the multi-professional framework. You need to look at your clinical capabilities. You need to map out your individual learning plan so that you can help with those supervisors to ensure that you can meet the levels that you are required. That just means you can build up smart objectives and you can use portfolios and you have that clear scope of practice. It also enables you to sort of bring in the different supervisors within your role. So your educational supervisor will be coordinating everything with you, but you maybe say to them, I need, this is an area of weakness, I need to do more on dermatology. And your educational supervisor says to you, okay, Kerry, this is great. I know this one person, they specialize in dermatology within the practice or the PCN, and I think you should spend some time with them. Here are some other things that you can have access to. So it's really what they're doing is looking at signposting and sort of navigating you through those areas for you. You've also got to think about, as I said, about that professional development and transition. So we're all coming at it from different levels. As a trainee, you're coming at it from a different level. You may be a very experienced individual as a trainee who's done lots of academic level before they've done their official MSc or completed their MSc. So it's really just to be aware that individuals are coming at it from different levels of learning, and they will be when they've finished as well. There's also a lot of social professional factors. So with this regulation of advanced practice for the NMC, at the moment, HCPC and the GPHC are not going for regulation of advanced practice, but they are looking at everything that's going on. And that is something that they will look at doing in the future. And the NMC are obviously very aware of that, but it's just to say there's going to be a bit of a split soon with regards to those sort of expectations. And also just to raise awareness that advanced practice is not, you're not trying to be a sort of substitute for another profession. What you're trying to do is sort of add value within the team. We talked about an integrated approach. So these single supervisors cannot cover the breadth of development necessary. Really pull on the rest of the team. Pick out the individuals within the team that will enable you, that you think will be a great supervisor, but also individuals that you think, oh, I'd quite like to go and sit with them because they know a lot more about MSK, may not be coordinating me, but actually they'd be the great person to sort of go and sit in with. And also that they may not hold the same registration as an advanced practitioner, but you can sit in with other advanced practitioners within your workforce as well. Noting that if you have an advanced practitioner as your supervisor, there are minimum standards that they have to be called your educational supervisor. And we'll talk about that shortly. So just as we said, the coordinating educational supervisor, if they are an advanced practitioner, they have to have a minimum of 3 years of undertaking the role. That's the standards that they're saying from a minimum standards to that coordinating educational supervisor. Now, this advice is under if you were a trainee. It's recommended if you are an advanced practitioner that you follow this as well. But obviously, it's not part of the commitment. It's not part of the funding. So it's just to be clear that this is sort of the recommendation. The individual needs to have an awareness of educational theories and terminologies. They have to be aware of things like off-the-job components, signposting, making sure there's a sufficient structure within the workplace. They can act as sort of like that link role and look at that progression of the individual. And they can obviously be confident enough to address the sort of professional and public safety issues, particularly when you have things to do with trainees in difficulty or significant events. They need to be aware of financial support that's available and also around things to do with the CPD that's available for those individuals. As an associate workplace supervisor, they need to be experienced practice-based educators, experienced in practice-based education, and they obviously have undertaken some supervision of registered professionals in the past. They need to have awareness of that multi-professional considerations and work collaboratively within the team and have it written in their job plan. It's really important that it's recognised the value that they're adding to the rest of the team. and obviously if they want to develop to become coordinating educational supervisors, then it's for them that it's sort of recognised as their own CPD in the future. As an employer, the employers need to complete something called a governance maturity matrix. This is an overview of where the practice sits at with regards to their leadership, their clinical, the research, the supervision, the workforce planning. So it's a bit of an overview. And if you've got a trainee within your practice, you will definitely have one of these. So I would advise that you look at it. Be cautious because it's not really set up for general practice, and we've argued that quite a lot, but it does raise awareness, and it is going through a few sort of transition sort of changes as well. But it's just really to raise an awareness that it's actually in there. And as a CQC, if you have a trainee, they will ask to look at this as well. We went through things to do with job plans, stuff to do with learning needs analysis, but also some of the biggest things is around organisational policies. So what policies do you have within your organisation to do with supervision? And also what innovative things do you have? Because obviously facilities are really tight with supervision. So what other things are happening? So are you having some peer discussions? Do you have there's lots of things that you can consider to do with sort of facilities of supervision as well, but also identifying things that are available to do with the individual's well-being, legal issues, particularly around sort of regulation and legally to do with sort of that commitment statement that individuals sort of signed up to as well. But also, do they have that protected time to have that supervision within their job plans? There's a bit here on sort of flexible working and safe learning environment, and that's because these are two documents that are out at the moment with regards to safe learning environments and flexible working, and the resources will be at the end of the slide, so please do have a look at them. And supervision has handed out, it is the responsibility of the employer. So it's for them as part of their responsibility to provide supervision for the individual, but that really depends on, as I said before, lots of factors, whether they're a trainee or not, what the regulation requires from their role, the organisational policies, their employment models. There's lots of things that need to be considered. With that development of supervisors, because everyone says, fine, great, you know, it's quite a lot to take what we need to be supervisors and to be effective, but how are you going to develop me as a supervisor? Because it's really important. We're saying you've got these minimum standards you have to be at, but what is out there to be that sort of supervisor? Now, there is a regional approach to this training, particularly for GP trainees and advanced practitioners. So there's a multi-professional modular supervisor course that's in its sort of first phase, where individuals who meet the criteria can attend, and it's 2 mornings first, and then there's bolt-on sessions. The 2 mornings are very generic, and then the bolt-on sessions are around FCPs and advanced practitioners. So there's a regional approach to training. We're looking at developing some local approach to training for those supervisors as well. Hence, this is an introduction to see, you know, is there any sort of need that anyone feels they want? And there's also that sort of awareness of the common features, but then there are specific features as well that individuals need to sort of meet. And to identify those different barriers that you have towards supervision, and also to offer some sort of change or different approach to supervision. In BNSSG itself, here's just some of the support that's happening at the moment. So one of my other roles is an advanced practice legacy role, and that means I can support individuals and practices with regards to individual learning needs analysis, so that's sort of mapping and scoping, and offer sort of one-to-ones with staff and employers. We've got the forum and the MS Teams, so if you're not part of the MS Teams, please do join up. We try to have forum sessions on a quarterly basis. That's varied across the years. It's been going for a long time now, but actually we found on a quarterly basis it's proved a bit more effective. With clinical supervision, we did some initial supervision for nurses. And as I say, we're working with the Primary Care Academy and potentially sort of the ICB with around specific clinical supervision training for advanced practitioners. And my role is a lot to do with that sort of liaison with different areas within the organisation, particularly to do with higher education institutes, of where they have different individuals and what they need from their trainees, but also identifying sort of opportunities to do with CPD and simulation as well. I attend, as you know, regional and national meetings, and I'm sort of obviously trying to push forward that balance of around what's happening at a national level, where we are locally, and trying to acknowledge that we've got a massive number of individuals who are working at that advanced practice level who may not have the full masters that may be coming in the future from the regulatory requirements, or may, you know, maybe at the end of their career, and you know what happens with them at that point, which is why we're working with the NMC on this transitional sort of period, because I really don't want to lose that experience of those individuals already in practice, but acknowledge that actually times are changing and things are moving forwards. And for the new trainees that are coming in, it's brilliant because there's regulation and then there's standards and there's funding, and that's absolutely fantastic. And it's fantastic for professional and patient safety. But what about the existing workforce that we've got? So that's an area that I'm working on, and I'd love your feedback on that. I'll be sending out an email shortly around the NMC requirements. So I'm working with Penny Lewis. So Penny is our new advanced practice trainee fellow, and she's been beavering away in the background to produce loads of really valuable information and resources for advanced practitioners that we're soon sort of put on our website in an easy way for you to access it as well. And we're really looking into producing some sort of networking and peer support events over the next couple of months, and then also looking at that sort of preceptorship level. So when individuals have completed their training, what happens then? Because we think it's really important that they can obviously do that as well. So just bear with me. I'm going to stop presenting now. And I just wonder if anyone's got any questions, and you may not have any questions, and that's absolutely fine because that's quite a lot to take in. But it was just to raise awareness with regards to advanced practice, where we are at the moment, and what sort of where we're sort of moving in the future. And if you don't have any questions, that's absolutely fine. But thank you very much for coming. You are very welcome to leave now. We will stop the recording. I will stay on, and so if anybody's got any questions that you want to ask off the recording, then please do stay on and ask the questions.